Canker sores, also called Aphthous ulcers, are small, shallow lesions that develop on the soft tissues in your mouth or at the base of your gums. Unlike cold sores, canker sores don't occur on the surface of your lips and they aren't contagious. They can be painful, however, and can make eating and talking difficult. Signs and symptoms: a painful sore or sores inside your mouth, on the tongue, on the soft palate, the back portion of the roof of your mouth, or inside your cheeks. A tingling or burning sensation before the sores appear. Sores in your mouth that are round, white or gray, with a red edge or border. Cause: the exact cause of most canker sores is unknown. Stress or tissue injury is thought to be the cause of simple canker sores. Certain foods, including citrus or acidic fruits and vegetables, such as lemons, oranges, pineapples, apples, figs, tomatoes, and strawberries, can trigger a canker sore or make the problem worse. Sometimes a sharp tooth surface or dental appliance, such as braces or ill-fitting dentures, might also trigger canker sores. Some cases of complex canker sores are caused by an underlying health condition, such as an impaired immune system, nutritional problems, such as vitamin B12, zinc, folic acid, or iron deficiency, or gastrointestinal tract disease, such as celiac disease or Crohn's disease. Natural home treatment: how to cure. 1 DIY numbing spray. Peppermint and eucalyptus essential oil both have anti-inflammatory properties, while also possibly working as antimicrobial agents, thus reducing chance of infection. Astringents to help tighten the tissues around the wound, relieving further discomfort caused by swelling or potential fluid buildup. The cooling properties of both of these oils can also numb the nerve endings that are firing off. You will need 2 tablespoons of olive or grapeseed oil, 10 drops of peppermint essential oil, 8 drops of eucalyptus essential oil, a glass mister bottle. Directions: pour the olive or grapeseed oil into a glass mister bottle, and add the essential oils. Cap, shake well, and spray some directly onto the canker sore as needed for pain relief. Shake before each use. 2 chamomile tea bag. Chamomile consists of several daisy-like plants that are most commonly used to induce sleep, promote relaxation, and help with digestion. It works a treat with cramping since it can help relax painful spasms in the digestive tract. A chemical compound called bisabolol, or levomenol, is found naturally in German chamomile, and has been shown to reduce inflammation and also have antiseptic properties. Both of these properties will help reduce the pain of canker sores and potentially help speed the healing process. You will need 1 bag of chamomile tea, or a tablespoon of dried flowers wrapped in cheesecloth. Fresh water. Directions: soak the chamomile in water for 1 minute or so if using a tea bag, and 3 to 4 if using dried flowers. After soaking, place it directly against the sore for 5 to 10 minutes twice daily to help relieve discomfort and promote speedy healing. 3 Swish sage. Sage is an herb from the evergreen shrub, Salvia officinalis, in the mint family. It used widely in the culinary world, and has also been prevalent in homeopathic medicine and home remedies for years. Native Americans used sage long before modern medicine to help cleanse the mouth, and to heal the painful ulcers that we now know as canker sores. You will need a handful of fresh sage or 2 teaspoons dried sage, 4 to 8 ounces of fresh water. Directions: if you are using dried sage, boil your water and allow the herb to infuse for 10 minutes. Swish the water, and the herb, in your mouth for 1 minute before spitting it out and rinsing with plain cold water. You can also make a tea-type rinse with fresh leaves, but I prefer the following method. Place your sage leaves in an airtight glass jar in a cool, dark place and allow them to infuse for 24 hours. Swish the liquid, sense the sage, in your mouth for 1 minute. Lightly pound the soft, moist leaves to a pulp and then place the pulp directly over the sore for 5 minutes. Rinse with plain cold water. 4 Coconut oil. When in doubt, use coconut oil. Anti-inflammatory, antimicrobial, and also incredibly tasty, coconut oil is almost fail-safe when it comes to getting rid of canker sores. You will need coconut oil. Directions: using clean hands or a cotton swab, dab a liberal amount of coconut oil onto the sore. Try to get a somewhat thick layer or clump on there. Coconut oil melts rapidly and a thin layer just seems to slide right off. If you feel like you really can't get it to stick, melt 1 tablespoon down with 1/2 teaspoon or so of beeswax to thicken it. 5 Clove oil. Cotton ball clove oil contains eugenol, a potent painkiller, and has been used by dentists throughout decades to bring relief to patients. All those old-time depictions you see of dentists with giant pliers and their patients appearing to be in agony? They clearly forgot the clove oil. Eugenol is still used today, although in a pure extracted form, but clove oil remains useful for oral pain ranging from toothaches to canker sores. You will need 1/2 teaspoon of olive oil, 4 to 5 drops of clove essential oil, cotton balls, warm water/salt water. Directions: swish your mouth with warm water or salt water to get the area clean, allowing the clove oil to really sink in and do its job. Mix the clove oil with the olive oil and then soak a cotton ball in it. Apply the cotton ball directly to the sore for 5 to 8 minutes for numbing relief. 6. Honey rub with its antibacterial and potentially anti-inflammatory properties. Raw organic honey makes a wonderfully soothing coating for a painful canker sore. You will need a wee dab of organic raw honey. Warm water. Directions: swish some warm water in your mouth, and then apply a thick dab of organic raw honey directly to the sore. Reapply 2 to 3 times daily. At least one of those times should be before night, as it seems to do best when you aren't bothering it by talking or eating. 7. Wax cap. If you have a sore that keeps rubbing against your tooth, or if you have braces and/or dentures that are irritating the sore, putting a little wax capping over the surface can help reduce irritating friction against the sore and help speed up the healing time. If you are placing this over braces, it's important to make it thick enough that it doesn't just get ground into the brace and stuck. You will need 1 tablespoon of beeswax, 2 teaspoons of coconut oil. Directions: melt down the beeswax and coconut oil and allow the mixture to cool slightly. When it has cooled, gently press a dollop over the edge of your tooth/braces/dentures to protect the canker sore from rubbing.